All right, welcome everybody to our stakeholder call. I'd like to introduce you to Tracy Gruber, the Executive Director for the Utah Department of Health and Human Services. This meeting is being recorded. Take it away, Tracy.
Thanks so much, Joe. And for those of you who do not know Joe Doherty is our Director of Public Affairs and Education. And we're really happy to have him as part of our team here at the Department of Health and Human Services. We want to welcome all of you today to this stakeholder webinar. We were doing quite a few of these as we were moving on with the merger for several months. And then as we got closer to the finish line of July 1st, we were just doing the mechanics of the merger and didn't have as many stakeholder calls. And we're really excited to have this one today with all of you, and just extremely grateful that you've taken the time to join us today. We know that you are all very busy, and taking 45 minutes to an hour out of your day is a lot, and we're just very grateful. Again, I just want to mention and share our excitement that July 1st, last Friday, came with a lot of celebration for our department as we came together to have the Department of Health and Human Services officially launched. We now have the legal infrastructure in place. We still have to go through recodification with the state code next year, and that's underway with the Office of Legislative Research and General Counsel. But having July 1st come with all of that brought, and having our staff together, working together to serve all of you and to serve the public was very exciting for all of us. Nate Checkitz and I shared some reflective emails with our staff to celebrate where we have been in each of our departments and the successes that we've had together, and wanted to make sure that we communicated with our staff who is moving on to this new department, that while we close a chapter behind us of the department separately, we open new doors as a new department, and we get to see all the challenges that this presents, as well as what we all know will be exciting opportunities to grow and serve the public in so many ways. So we're no longer just health or just human services. We are a comprehensive and coordinated system of health and human services, and our mission is aligned to help people and serve in this noble work. We're very grateful to our staff. It's been a challenging several months, both with the merger and the pandemic, but also to all of you who've been on this journey with us. And while we've got the legal infrastructure in place, we like to say that July 1st was an important benchmark, but there is definitely more to come. So one of the things that we shared last week with our staff that we wanted to share with all of you is that we asked our staff to share some photos. We know many of our stakeholders also have served in one of our departments at one time or another. And so we asked people to submit photos and put together a very brief video that we wanted to share with all of you before we get into where we're at with our results-based accountability plan.
Two agencies coming together. It's been 41 years since we were separated into the state's two primary social services agencies, the Department of Health and the Department of Human Services. Since 1981, our agencies have implemented reforms in welfare, child support, child welfare, and juvenile justice. We have come together to respond to major catastrophes, such as Hurricane Katrina in 2005, and the global COVID-19 pandemic in 2020. We have implemented healthcare reform to include an expansion of Medicaid coverage. We have designed, implemented, and adapted to complicated technology and systems that help us better serve people around the state. In these 41 years, we have learned so much. We have gained the tools, the knowledge, and the shared experiences to do a better job than ever before at strengthening our fellow Utahns, so they have the knowledge and tools that they need to live healthy lives, both physically and mentally, and thrive in their homes, schools, workplaces, and communities. While our work can often be challenging, the relationships made along the way have carried us through the good times and the bad. While this consolidation brings the end of an era in one way, it begins a new chapter that we're excited to be able to write together. So what does the future hold? This consolidation will help us better meet the needs of our communities with a more effective, seamless system of services and programs. We've done great work separately, and we know we'll do even better work together.
Thank you so much to the team for putting together that video and sharing it with all of us. Before we move into RBA, just wanted to go through a few housekeeping items. We always make closed captioning available for those of us who need it. I happen to be one of those, and you can click on live transcript at the bottom so that you can get that closed captioning. The meeting is being recorded, and we make those available as well. We will be sending out the link. We know with everybody's very busy lives, they can't always fit time in on the schedule in which we're having these webinars. So we are recording that. So we want to make sure you're aware of that. And when we move to the Q&A section, you can add your questions in the Q&A button, and our staff will manage those and put them in a document for us on the DHHS side to handle those questions as they come in. So we'll make sure that as we're moving to that part to alert you to that Q&A button once again. Before we move into RBA, to our plan, our strategic plan, which is what we wanted to share with you today in its draft form, to make sure that we're getting feedback and having the opportunity for feedback from our stakeholders, is that throughout the year, we had many questions. We had 4 primary questions that came to us about the merger. And before I move into that, I just want to quickly, briefly highlight those. One was, why merge at all? 2 is, why merge now at this time? 3 is, how is this different than things were in 1980 when the 2 departments were split? And then the last, which really is the focus of the conversation, is how are we going to know that how are outcomes going to improve through this merged department, which is really what bringing the Department of Health and the Department of Human Services together is really about, is improving outcomes for the individuals, families, and communities that we serve. So why now? Without going into too much detail, people were always a little bit surprised that this was happening at the time that we were handling the pandemic over at the Department of Health, and it seemed like a lot to take on. But that timing also provided great opportunities for us to leverage so many of the important lessons gleaned from the pandemic, from increased collaborations to the need to improve connections with local health departments and data. So at a high level, the timing actually could not be better. It's a lot for everyone to handle in terms of workload, but as I mentioned, our staff has done just an amazing job. Why merge at all? Very early on, for those of you who joined us in the earlier dialogues, there's significant overlap in the populations that both of these departments to the individuals that these departments serve. 60% of the individuals served at the Department of Human Services were also served at the Department of Health. So we have a great amount of overlap in the individuals that we serve. And then we also had some similar programs and similar objectives. So for example, both departments had suicide prevention programs. Both departments had aging type programs relating to the aging population. And so by bringing together, we create the opportunity to leverage all the resources, set a similar course for goals that we want to achieve, and we can move in the same direction and increase and accelerate the ability to achieve those objectives. So those are quick answers to the first three questions. And then the most fundamental and important question is, how is bringing these two departments together really going to make an impact for Utahns? And that's where we come to the primary focus of our conversation today. And after today's meeting, you're going to get a draft of our performance measures for the Utah Department of Health and Human Services and our results-based accountability plan that ensures that within our department, we are really focused on outcomes and that we are measuring through the use of data that we are moving in the right direction to achieve those outcomes. And the structure that we use is a framework called results-based accountability that some of you might be familiar with. It comes from a book by Mark Friedman, who has been in the public sector for many, many, many years. And the foundational book that establishes what the results-based accountability framework is a book called Trying Hard is Not Good Enough. So we leveraged this very early on. We knew and were encouraged by our colleagues at our policymakers at the legislature to really start narrowing in on data and performance metrics. So with that, we'll just start going through the results-based, the structure of the results-based accountability plan that we've developed the draft of. And I want to emphasize, while this is a very comprehensive plan, the reason that we're having this meeting today is to encourage you to provide feedback on this plan. We have that feedback form that has been made available all throughout the merger process. And so as you're reviewing this plan and see where you and your organization or the role that you play might fit in this plan, to provide us with some feedback. So again, we knew that we wanted to be accountable, not just to the public, but to the legislature and to ourselves. And we know that we are all in this work to change, to improve lives and improve outcomes. So the way that we want to make sure that we are ensuring that accountability is with this framework. And so this is the department's overarching plan. Not only will we have a department-wide plan, which is what we're sharing with you today, but each of our organizational units, so the Division of Child and Family Services, or the Division of Juvenile Justice and Youth Services, or the Division of Integrated Healthcare and Division of Services for People with Disabilities, every single organizational unit in the department will also have a corresponding plan. And if you think about the plan that we're going to share with you today, we're setting the primary department-wide plan with these organizational unit plans being leveraged to further and advance this department-wide plan. So the department-wide plan is kind of at the top of the pyramid, with the organizational unit plans rolling up into that plan. So what is RBA? What is results-based accountability? It's a disciplined way of thinking about complex problems to ensure that processes, products, services, all are moving to the result, to get a desired result for our communities. And frequently what ends up happening in the human services sphere and in the public health sphere and many of the social services is that we have a bunch of strategies that we think are going to move the needle. Sometimes they do, sometimes they don't. We tend to get spread really thin on some strategies that may or may not move a particular outcome. And the way that RBA works is that you start with the outcome that you want. And in results-based accountability language, the outcome is synonymous with the term result. So you start with the result that you want to have accomplished, and then you make sure that your strategies that you're implementing are part of that result. So what do we want to accomplish? What is the overarching result that is in this plan? And I'm hoping you can see it. This is what you're going to get a draft of that has way more detail than what I'm going to share with you today. We established a vision for the department at the very outset of the merger. So last June, you may recall that we created a vision. And within that vision, we have our overarching result statement that all Utahns have fair and equitable opportunities to be healthy and safe. And so in this model of RBA, when you have a statement like this, you have to start asking the question, what does it look like in Utah for this result to be present in our state and in our communities? What does it mean for people, not by measuring anything, but just anecdotally, what does it mean for our state for people to be healthy and safe, statewide in every community, in all populations? And so we start asking that question about what is it, how do people experience health and safety? And from that, we know that we want Utahns who are free from harm, abuse, and neglect at school, at work, and at home. We want people to have a say in the decisions regarding their health and well-being and a voice in their community. And once we start thinking about what does it look and feel like, then we start to get into what are the indicators that we want to track and identify to know whether or not we are moving and making progress to ensuring that all Utahns are healthy and safe. So within our results-based accountability plan, we have 6 what we call population level indicators that will help us at the department level. And what we hope is that this is a vision and a result that all of you can also support and also be working towards successfully achieving. And so we pick 6 what we call population level indicators that we will be tracking to see whether or not we are making progress on this outcome. And I'll quickly read those. Again, these are in the document that you're going to receive a copy of. So one is that we want to make sure that key health and safety indicators have no health disparities, so that there's no disparities in those indicators, that everyone across the state and all communities and geographies and socioeconomic classes and races and ethnicities are experiencing health and safety indicators the same equitably across the state. We also want to make sure that our Utah small areas that we have in the Health Improvement Index are reducing the risk of health disparities as measured by that Health Improvement Index. We're going to be looking at the percent of adults and children reporting that their physical health is good or better, that adults and children are reporting good mental health, the rates of abuse and neglect. Obviously, we want those to be down in terms of safety, and life expectancy at birth. So those are the population level indicators that at the department level and statewide that we will be keeping track of as part of our RBA plan. So we invite you to kind of provide some insight into that piece as well. And then we've got this overarching result, and then we want to make sure, as I mentioned earlier, that the strategies that we want to employ in the department at the department level are going to be leveraged to move towards that result. And I mentioned that in addition to this plan, we also have all of our organizational units, all of our various divisions, that are also going to be creating RBA plans with their own strategies that are going to be leveraged to move that result. So what are the 5 strategies at the department level that we are proposing that we promote? So we're going to introduce you to 5 strategies that we identified. And I should note that we've been working on this plan for really since August, so just about 10 months, to talk through strategies and indicators and priorities. And so the 5 strategies that we have, we'll start with strategy 1. And for each of our strategies, we not only have the strategy that we're going to employ, which will include kind of sub-strategies or tactics. So you get very specific as you go down into the more tactical level of the plan. But our biggest strategy, our strategy 1, not our biggest strategy, they're all important, is to ensure that quality care, services, and programs are accessible where and when they're needed. And again, when you look at the overarching result that all Utahns have fair and equitable opportunities to be healthy and safe, accessibility is also statewide, geographically accessible, economically accessible, all of those various components that we look at. So if we're successful, we envision that Utahns will have experiences that there's sufficient providers throughout the state, and there's services accessible in every community, that information about how to access services is readily available in multiple formats. It's ready in social media, and it's ready in print, and it's ready in different languages. And that individuals are empowered to make their own choices and decisions regarding their health and well-being. And similar to the overarching result for each strategy, we have indicators to track performance, to know whether or not we are successful in implementing that strategy. So a couple examples there is the rate of Utahns who have access to health insurance. How many health provider shortage areas are there in the state? That's an indicator that we look at. Are there enough physicians? Are there enough dentists? Are there enough mental health providers? So that's how some of the indicators that we'll look at strategy 1. Strategy 2 is really speaking to our environments that we live in, communities that we live in, and we want to make sure that we're fostering safe and supportive environments. And if we're successful in that the experience for Utahns is that all Utahns will be safe and be supported in their homes, schools, workplaces, and communities. Programs and services that we provide by the Department of Health and Human Services will help safeguard children, youth, families, and adults from violence, exploitation, abuse, and neglect. And individuals experience meaningful relationships with family, friends, coworkers, and social groups. And again, we'll have indicators that will allow us to measure and track whether or not we are successful there. One is rates of youth delinquency per 100,000 population of youth ages 10 to 17 years old. Percentage of Utahns who report feeling socially isolated from others, and percent of youth, number of individuals receiving home and community-based services. On strategy 3 of our 5 strategies that we are proposing that we work towards to achieve that result, we want to improve health outcomes, both physical and mental health. Many of you probably know that we have a division of integrated healthcare that is bringing together both physical and mental health. We have health prevention and promotion that's focusing on prevention of physical health issues, but also mental health challenges. And so strategy 3 means that we're considering health holistically. The various drivers such as social, economic, and physical environments, poor physical and mental health outcomes are going to be minimized by prioritizing things like prevention and early detection and management of illnesses. And while this is includes both health and physical health, physical and mental health, many of the challenges that people have with health outcomes often manifest in the department's more deep end services. So involving involvement in the child welfare system or in the juvenile justice system, or abuse and neglect of our aging population. So we know that if we address and attend to both people's physical and mental health comprehensively, we're going to be reaching those individuals who may otherwise be in our deep end services. So what are our indicators for this? Well, a couple of them are rates of suicide deaths, rates of overdose deaths, rates of infant and maternal mortality for strategy 3. For strategy 4, we start thinking more internally about our department and what our department needs to do in order to provide the right foundation for us to achieve this result. And we know that we need to create a high quality and efficient department. It's great that we have all these great programs, but we need to provide these programs at the highest level of quality and efficiency. And when we talk about efficiency, frequently people think, well, efficiency means you're going to be eliminating jobs. And that has always been very clear from the outset of this merger, that there is not a plan to reduce jobs in the Department of Health and Human Services, but to leverage the staff that we do have, which with the merger is now 6,000 employees strong. Making sure that the staff, there's not duplication in the staff. I mentioned at the beginning that both departments have had similar programs for similar needs in some areas. And so we want our staff to also, that we do have, to be, for their own benefit, be efficient, but also for the public's benefit. So when we think about what it looks like to have a high quality and efficient department, it's that the department, division, and program leadership will be providing administrative support and implementation of organizational best practices to provide the foundation so that our staff are empowered, they're knowledgeable, they're innovative, and they're effective in their work. We want our workforce to be diverse, resilient, and healthy. And that we're collecting quality data that's analyzed and reported and used to drive decision-making. And starting off with this plan itself, we really want to be able to be leveraging all the data that we're collecting in a meaningful way that helps us in our decision-making. So in terms of the indicators related to this, we want to make sure that all of our organizational units have an RBA plan, for example, that they're engaged in continuous quality improvement, that when there are problems, we look at those problems or challenges and we address them in order to make the service that we're providing at a higher level of quality. We're going to be looking at employee retention, which in some of our divisions right now is really struggling. Having a workforce that's well trained and retained is incredibly important to providing a high quality service. And so the last strategy that we have employed is the strategy to build public trust in the Department of Health and Human Services. And this is really important. We want the public to have confidence in our department, to establish and continually improve the seamless system of services and programs that are measurably going to reduce public health and safety. We know that we're getting involved sometimes in people's lives when they don't want us to be involved. We know that we get called when there are challenges in people's families. And in order for us to ensure that health and safety is preserved, we need the public to trust us and to be partners with us. And we saw what happens when that trust is eroded or diminished in many areas as it related to the pandemic. When we talk about things like needing to have a vaccine, not only for COVID, but for all of the illnesses that we have vaccines for, people will not get vaccinated if they don't trust the department, and they don't trust the information that we convey. And public trust is a key tenet for our department. So we're going to be focusing on that, and some of the indicators that we have there will be just self-reported, some surveys on public trust, and people who are referred to for our services who voluntarily enroll for services. Uptake in services is a measure of public trust. And then, of course, when we have things like audit findings, are we addressing those findings and making improvement? So that's a lot of information on our RBA plan. Again, we hope that you'll read through it when you get a copy of it, and that you will provide feedback to us. We are inviting feedback for the next 4 weeks, at which point we want to get the final document ready. We are baselining the indicators, and we know that in order for us to be successful, we need your buy-in. So it's critically important for us. So before we move on to the Q&A, and as I mentioned before, you can enter your questions. You obviously can't unmute your microphones or turn on your cameras, but you can enter your questions in the Q&A. We just wanted to make sure that you all are aware that you can now find information about the department on Twitter, Facebook, Instagram, YouTube, and LinkedIn. I believe we can put in our various handles in here. I think they're primarily Utah DHHS. I know that's the Twitter handle. We've been regularly posting, especially in light of the July 1st deadline. And we really hope that you will follow on our social media channels, where we are really striving to keep the public informed of what's going on across the department. You probably saw some threads on the infant formula shortage. We're still putting posts up on COVID, and yesterday we had posts about a report that we're releasing on guidance on postvention for suicide prevention. And so we invite you to follow us along. Let's move into the Q&A portion of the meeting, which is really where we like to spend the bulk of our time on these calls. It's our preference not to always just give a bunch of information and spend the full hour giving information to you, but also provide opportunities for you to ask us questions. So you also can read people's questions in the Q&A and upvote. So if there's a question that you see that you feel you really want us to answer, it allows you to kind of elevate those questions. Because there's so many people on this call, 185 people, which is fantastic, we might not be able to answer all of the questions. So we'll do our best to get through those and follow up on any that we aren't able to answer. And the way that we approach these is that we try, assuming there isn't something in the question that we don't feel that we can repeat, to repeat the questions verbatim so that there is transparency on the question that's being asked in our response. So there's several members of our leadership team that are on this call who will be helping me to answer questions as they come in. And what we'll probably do is we know who we want to answer which question, so they will come on camera and be unmuted. And the first question is for Nate Winters.
All right, thank you, Tracy. So the question is, will DHHS have or create an org chart in-house so that employees know who to go to with different questions across the different departments? So yes, we actually have an org chart currently out on our website and on the transition website. So you can find it at dhhs.utah.gov or hhsplan.utah.gov, and you can find the high-level org charts available for our department on those websites. I think I turn the next question over to Joe, who will answer our next question.
Yeah, I'll take that one. And thanks for already giving it a little shout out, Nate. So our new department, excuse me, department website is dhhs.utah.gov. And as you navigate that, you may notice that some of the links there will link back to old Human Services or Department of Health websites. Our first priority was get the main landing page for the department up and running and make sure that people can still get to where they want to go. As any website is, and you can imagine, it's still a little bit under construction, but we're continuing to improve that every single day. So thank you for watching, and we always look forward to any of your feedback on that site. If you feel like sending any to us, you can send it to dhhs@utah.gov. That's dhhs.utah.gov. We will also be including a link to the website and some of the other resources that Tracy mentioned in a follow-up email that'll come to all of you after this webinar.
Thanks, Joe. I'll take the next question, and Nate Winters, you might want to jump in on this one too. One huge concern for congregate care is the level of turnover at the head of the department overseeing licensing and investigations. We felt like we were making great progress in collaborating with Mike McDonald after losing Amanda Slater. We feel like much is broken, and every time we take a step forward, the leadership changes and we have to start over. What steps do you plan to take to keep leadership in place so that we can begin making progress? We feel collaboration is crucial, and right on the heels of finally getting it, we are starting over again and no real progress being seen. I think we share that concern, whoever submitted that question. We have had turnover. Amanda has been elevated. She is now the Assistant Deputy Director of Operations, along with Nate Winters, who's the Deputy Director over Operations. And licensing is within what we call sections. So licensing is in that section. So there is some continuity with Amanda. She has been overseeing the transition. Right now we have an interim director, Carmen Richens, who's been in licensing and background checks over at the Department of Health for many, many, many years. She brings a great degree of experience. She's serving in the interim capacity to stabilize that area. And it's definitely true. Converging licensing was one of those areas that we knew that we could create efficiencies, not only for our staff, but for all of our providers who were walking in both the human services world and the health world. And we want to make sure that the individuals in that role feel support. And there's no question that there has been turnover, and we recognize that that's impacting our providers. And we want to do everything we can to make sure that dialogue and channels are open. If you have any concerns, please reach out to Amanda and Carmen, and we'll make sure that we're continuing to dialogue with our providers, with our regular calls with providers, so that we can troubleshoot some of those challenges. It is the position of this department that our provider community and our private providers are critical to really achieving that outcome and critical to serving Utahns. And so we want to make sure that we have a licensing and background check division, which has great leadership with Simone Bolivar, who's been overseeing childcare licensing, Carmen, as I mentioned, to make sure that we are working collaboratively with all of you to serve the people of Utah. Nate, I don't know if you have anything you want to add there.
No, I think you nailed it. I think, obviously, we've been working through this as well, and Amanda is a fantastic resource and really is helping provide some of that stabilization at the department level as we work through this, the turnover we've had in this position. I think in addition to Amanda being elevated, over the last couple of years, some of our other Office of Licensing directors are also still within the department, with Diane Moore and Brett Peterson both being, elevated to division directors within the department. So, definitely have some strong bench in the licensing area and full support and confidence for Carmen and Simone and team as they move forward.
Thanks, Nate. This next one is more a comment, and just I'll at the outset express our strong agreement with the statement. Commitment to better sync up different reporting software programs that integrate better communicate with each other, and most importantly, create efficiencies with the end user reporting agencies. The example given was area agencies on aging, giving them single point data entry that feeds required program reporting and funding source requirements would save tons of time for local staff and allow for more service time versus admin time. Important not to make siloed decisions on these programs. Again, totally agree. As we said, part of our vision is creating a seamless system of services and programs, and that includes things like our IT infrastructure, which we are spending the next really 5 years building out with a significant amount of funding that we were given by the legislature from the ARPA funding, the COVID funding package that was released from the federal government last year. We also have a new division that we are building out, the division of customer experience. And we're using the broad definition of customer. We're not just talking about the people that we serve in maybe one of our programs, but we're also talking about all of you. And we're talking about our area agencies on aging who are serving the public, and our local mental health authorities and our local health officers. So we want for all of us, for all of you, and for our staff to have that IT infrastructure that is going to best support the community and our staff to create those efficiencies. So thank you for that comment. I think the next question is for Nate Checketts.
Yeah, thank you. So question is, you mentioned some redundancy in programs such as suicide prevention and aging services. Will those staff portfolios change or be reassigned? So as we talk about different programs, there are programs that are operating in multiple areas, and our main goal is to get them working together. And they have often had contact with each other over the years. And so this opportunity, in some cases, as we bring teams together, or in other cases, as we've reorganized how those teams interact across the department, that we really see that as an opportunity for them to improve their program coordination and improve how they've aligned their services. There were early discussions that our teams had about potentially adopting similar models. That's something that we still need additional work and discussion on to see if that's the right way of moving forward in coordination of these teams. But we really see as an opportunity to improve the quality of services that we provide and make sure that we're all moving in the same direction together.
Right, I think I've got the next question. It says, you mentioned the importance of employee retention. What are your plans with all of the time-limited employees? I think it's important to note that, you know, across the Department of Health and Human Services, we have a number of time-limited employees that serve in various kind of capacities and responsibilities, as well as like kind of the scopes of what their time-limited agreement was. As we move forward, you know, taking a look at our time-limited employees and you know, what funding opportunities are available, or what you know, what funding opportunities are available to help, you know, fill these, or what you know, work could we stop doing to free up funds. You know, this is kind of a broad question, and there's a broad approach to how we look at them, but they will be looked at kind of on a case-by-case basis for the long term and how we use those positions.
Thanks, Nate and the entire team in answering the questions. These were the questions that have been submitted. And as I mentioned, we like to take time to be able to answer those questions. We're really grateful that you were able to join us today to hear more about where we're at with the merger, celebrate July 1st with us briefly, and hear about our plans through our results-based accountability framework. We really are looking forward to continuing to work with all of you to serve our state to get the best outcomes for everyone. And through this comprehensive and more coordinated and collaborative approach, we are incredibly optimistic of the opportunities that are being presented to us, and we hope you are too. Please follow us, as I mentioned before, on our social media channels. Don't hesitate to submit feedback in the feedback page, and we look forward to meeting with you again soon. Thank you so much and enjoy the rest of your day.